Hello, good evening, Chair and Council. Today I'll be providing an update on the district's work alongside Island Health, First Nations leaders, and other public health service providers to improve alcohol-related health and safety within our communities. As part of the presentation, I'll include a history of Tofino's municipal alcohol policy and our progress towards the development of a community alcohol strategy. What began as council's direction to improve safety and events on municipal property has evolved into a community-wide initiative to reduce alcohol-related harms and support a healthier, more inclusive community. So as a bit of an overview throughout the presentation today, I'll start with a brief background on work to date, followed by an overview of what a community alcohol strategy is and why it's important to Tofino. We'll go through the research and policy review that's informing this work, along with the community consultation and engagement underway and planned for 2026. Finally, I'll outline the next steps throughout the development of this community-led strategy. So to start us off with a bit of a background, over the past several years, Tofino's taken several key steps to set the stage for developing a community alcohol strategy. In 2021, the district adopted a municipal alcohol policy to manage alcohol use at public events and on public facilities. Council has also limited new liquor outlets and supported measures to reduce alcohol-related harms, including recent purchase restrictions at the BC Liquor Store. Health partners have long identified alcohol as a top local concern, leading to earlier needs assessment work. So together, these actions highlighted the need for a more comprehensive community-wide strategy moving forward. Then, in early 2005, Council directed staff to explore a community alcohol strategy following a notice of motion from Councillor Steer. And with Island Health's strong support, the district secured a BC Healthy Communities grant of $15,000 to fund early research and planning. The Community Alcohol Steering Committee launched later that year, so at the end of 2025, and work is now underway to shape the consultation framework and the project deliverables. So what is a community alcohol strategy? While many BC communities have developed and adopted municipal alcohol policies that really highlight restrictions or conditions on alcohol use on municipal property and at municipal events or events on municipal property, there are a few communities that have developed a more broader community-led community alcohol strategy. So a community alcohol strategy is something that brings together the local government, health partners, First Nations, residents, businesses, and service providers to address things like alcohol availability, safety, prevention, education, social norms, and long-term health impacts of alcohol use. A community alcohol strategy uses evidence-based tools to create healthier environments, support responsible use, and strengthen social connection without making alcohol the primary focus. It can also shift norms, improve safety, expand alcohol-free options, and guide policy in areas like events, licensing, land use, and retail. So this project is the first step. It's a preliminary engagement and planning process. That was the scope of the grant that we received to engage residents, First Nations, youth, businesses, and service providers to understand local concerns, how alcohol fits into the landscape socially in Tofino, and what some opportunities could be. So the outcome will be a community-informed framework and roadmap to guide a potential full strategy in the future. So in December of 2025, at the end of last year, a community alcohol steering committee was struck. To support the strategy, a group of representatives from the through different organizations that you see on the screen were brought together, and it held its inaugural meeting December 8th. So this is bringing together leaders from local governments, First Nations governments, protective services, public health services, Island Health, and people who work with those that have personal lived experience with alcohol use. The committee aims to provide guidance, local knowledge, and community perspectives throughout the project, and together hopes to ensure the strategy is grounded in collaboration, equity, and real community needs. So as a part of this process, the development of a strategy framework will be informed by a comprehensive review of local data, existing municipal bylaws, provincial licensing structures, alongside research on effective alcohol policies from other rural and tourism-based communities. The work will include analyzing local health and safety indicators, mapping alcohol availability, and reviewing the district zoning, business licensing, and event-related regulations. The project leads and the steering committee are also studying successful strategies from comparable BC communities to identify evidence-based approaches that reduce harms while supporting community well-being. So admittedly, there are limited strategies, community alcohol strategies available or that have been enacted across BC. However, there are some, and Tofino is looking for a sort of made in Tofino approach that will work for our communities and our neighboring communities. And the research aims to ensure that the strategy is informed by the local realities, best practices, and proven policy tools. So this grant was for this community engagement and research planning process. And so that is really the meat and potatoes of the work that's being done this year. So that grant, the grant wraps up in September of 2026 with a final report due in October. And so all of this work will be completed by then. And this is a bit of a snapshot of sort of who we're including or targeting in the engagement and how we're planning on engaging. So while the strategy will ultimately benefit the entire community, the preliminary phase is focusing on those groups that are most directly affected by alcohol use. So that includes youth and young adults, people working in the hospitality and tourism industry, health and social service providers who regularly encounter the effects of alcohol use. Indigenous community members in recognition of the historic and systemic inequalities in health and wellness, parents and caregivers who influence youth behavior and well-being, and those with lived experience of alcohol-related harms. So those are the targeted groups that we're hoping to do the majority of the engagement with in town. However, there are some engagement tools that we're leveraging to gain perspectives from across the entire community. So to inform the development of the community alcohol strategy framework in Tofino, we're undertaking a series of engagement and research activities, and those include facilitated community conversations to gather input on alcohol-related concerns and ideas, one-on-one interviews and focus groups with youth, engagement with Cloquet First Nation and the Hausit Nation, health and social services, tourism industry representatives, and members of the hospitality and business communities. District staff have been working together with the steering committee and the project leads of this project to put together a communication campaign that's going to be launched shortly. So the public engagement work plan is currently underway, and the steering committee has reviewed and approved a community survey. This is planned to be launched as part of the initial sort of comms campaign launch for this project at the end of March break. So the 23rd, that week of the 23rd of March, we're planning on having a District Talk Tofino page, including it in our usual district communication channels, so social media. There's going to be a survey that's going to be live on Talk Tofino, and then to really gather more outreach with the community, we're also going to be planning potentially some open houses to share information and gather survey data that way, reach out to the seniors group, potentially set up at places like the co-op or other community like events that are going on in town to meet people where they're at, and really just try to get a really good measure of the community's feelings towards alcohol, some of the issues they see with alcohol, some of the benefits they see of alcohol, and just get a really good temperature check of the community to see what their values are and how alcohol can sort of tie into those or not. So next step for this project, September 15th is the final day of our grant for this sort of preliminary engagement and planning process. So we're really going to be doing all of this engagement between now and then. The community engagement is next. At the end of March is when we're really gonna launch that survey and launch all of our initial cons. That survey is gonna run for a month. And then based on how many results we get, if we decide we wanna potentially run it longer, we will. But for now, we're looking at about a month. And then once we get that data, we'll be able to sort of aggregate it, get a sense of potentially the initial thoughts that we're hearing from the community and go from there in terms of if the community is really tuned in with some of the alcohol related harms that we've been hearing lots about from our health community for a number of years, or if there's a bit more sort of knowledge sharing and a bit of an awareness campaign that might need to happen. So this first survey will be an initial information gathering to get a temperature check on the community. We're going to do a comprehensive review of any policies related to alcohol use within the community and how the data that we compile fits into those. And then following the engagement, we'll build a local alcohol profile. So using health, safety, and licensing data, review all of the relevant bylaws and zoning, and draw lessons from the effective approaches in similar rural and tourism-based BC communities. And then lastly, so a hopeful final deliverable of this grant project is going to be to develop a strategy framework. So not actually a community alcohol strategy per se, but a bit of a framework based on the engagement that we've heard. And we'll work together to shape the vision, the goals, and policy directions for the strategy, and then share the findings and draft for public input before seeking guidance from council on next steps or endorsement or direction. And then lastly, because this is sort of a new initiative or a newer initiative for BC communities, the community alcohol strategy, we're hoping that we'll be able to create a bit of a summary and a resource package potentially that we can use to inform other communities that might want to kind of follow suit. So that's it for me. I'll open the floor to any questions if council has any.
Question. Yep. So sounds like we're doing some great work there. I'll go to comments then, I guess.
Yeah.
And you're free from question.
Thank you. Thank you.
Great, thank you through the chair. I just want to commend the work that the committee has been doing in terms of their engagement in the have a project lead through Island Health, as well as Jamie and the work that they've been doing. And I just want to say that through the work that I do outside of my council work, this is really being looked at in the broader provincial and I would say at the national level. They're very interested in the work that Tofino has done specifically around our municipal alcohol policy and looking at how we've developed further with a community alcohol strategy. We get a lot of your Minister of Health just called me yesterday where she's getting feedback from the work that we're doing here in Tofino around this particular issue. So I really want to thank the work that staff is doing on this because it is a tremendous amount of work that is going on, but the engagement with the community so far has been incredibly positive. They're all very much wanting to be a part and have conversations around it. So thank you.
Thanks. Care to comment or? Okay, thank you very much.
Okay.